Healthcare in the United States is notorious for its high costs, comparatively low quality, and lack of adequate access to patients.
According to PBS NewsHour, the United States spends about $8,233 in a year per person, which is more than double the amount than other countries spend on healthcare. In an attempt to lower healthcare costs and improve the quality of care, President Barack Obama signed into law the Affordable Care Act in 2010.
Major hospitals have also played their part by shifting to lower care cost settings by relocating services and patients to community hospitals. Establishing partnerships between community and major hospitals is one way for hospitals to reduce spending and utilize their resources more effectively.
We will explore the perspectives of healthcare providers, communities, and patients on the issue of moving care to the communities. We will also investigate the current impact of the ACA and what improvements can be made to better suit hospital needs. Let's begin with insights from healthcare providers. So I've heard a lot about care being moved to communities. So hospitals are acquiring or buying these smaller hospitals left and right. From your perspective, what do you think? What do you think about this? Do you think this is a good move for smaller hospitals?
Well, first, thanks, Paula, for having me on. I think it's a no-brainer. Under the Affordable Care Act, coverage is exponentially increasing. Some even say that it's going to double, and even. Yeah, approximately, I think the last study I read was saying that 5.2 million new patients are going to be entering the population in the near future. So we're going to have more patients than ever, and by partnering with community hospitals, we're able to keep our services going. We're able to provide that quality care. At the same time, we're able to keep our billing rates up, even under this value-based system.
Well, we love that, Chuck. But what if patients start complaining that they're not getting quality care?
Don't worry about that at all. They'll be happy to go back to their communities. They're going to be closer to their loved ones, their family. Just that hometown feel. Quite frankly, I'm kind of happy they're going too. No, I'm just kidding. But we're able to, with moving them, relocating them to the community. We're able to free up a lot of other resources. So we're really able to provide an extremely high quality of care for those really sick patients. And with that, they need our help. We are for the patient after all. And if we're able to care for those patients, at the same time, the data shows that we'll be able to reduce our ER visits as well as our readmissions rates. And under the Affordable Care Act, there's incentive money in there for us. If we're able to reduce those rates. So once again, we'll get a little extra money in our pocket, if you know what I mean.
Now, how much is this going to cost larger hospitals?
Well, yeah, I don't have the exact figures, but I'm glad you asked because I've been investing in a few great ideas recently. The real mission here is a shift to outpatient because those are really eating our profits in the hospital. We can keep those inpatients. We get a little bit more money for those. But by shifting, outpatients out, we're going to be really saving costs. But not everyone is as successful as my hospital is. But one way, if you don't have as much capital, is to buy some retail clinics. They're going to be in the community, and you can really outsource a lot of those outpatient services to them. Along with that, I've even heard of some hospitals shifting to what's called a bedless hospital. So they don't even offer inpatient services. It's strictly outpatient. So they get the patient in, the patient out, and they can get paid for it. And it's a really bright future, Paula. We have a lot to look forward to.
So now that we've heard from Chuck, let's hear from a community hospital representative. Okay. So tell me, how has the ACA affected your types of facilities?
Oh, well, Paula, thank you so much for having me on the show today, but let me tell you something. Community hospitals, we're facing it the hardest. I mean, we're trying to take care of our patients, and we already don't have enough funding to do so. And policies like the readmissions reduction program from the ACA, they're really hurting us. We can't have patients in our hospital for more than 30 days. And let me tell you, in the community where I come from, we're trying to help patients who are the sickest, and they're also in a medically underserved area. So, I mean, what are we supposed to do?
How are you resolving such financial problems?
Well, I can't say it's been easy, because it hasn't been. But uniting with the larger hospital actually really saved us in the end. We're trying to take care of our patients, and we didn't have any funding to do so. But with larger hospitals giving us some money, we're able to add new staff, to help train new staff. We're also able to have resources to upgrade our IT system and even renovate parts of the hospital. So, I mean, all in all, it's been pretty good, even if it means dealing with people like Chuck, but it's all for patient care.
Were you not afraid of losing your autonomy with this merger? Surely you have more to lose.
Well, I can't say that the transition didn't have any challenges, because it surely did. But we've added more staff to help ease the flow, especially our transition into the new EMR system. That's been a problem in itself. But adding more staff and setting more policies to increase patient care have really helped the transition go smoothly. The more important thing is to realize that as a community hospital, it's all about the community. So we really tried to focus on merging with a larger hospital that had our same values and goals, and made sure that we were on the same page. Because if we weren't on the same page, I mean, it wouldn't have worked out.
What benefits are you seeing with this consolidation?
Oh, Paula, don't even get me started with all the benefits. We've been able to come up with treatments specific to our community that targets our community's problems. For example, we've been having a diabetic epidemic. So now we're able to provide enrichment programs for families to come and bring their loved ones and talk about educating them on diabetes and treatments for diabetes and how they can control it and everything. And also, we've been having great added communication between our providers. Now, with the EMR system, between the providers, the specialist at the large hospital and the outpatient specialist that we have at our hospital, we're able to communicate with patients if they need acute care treatment. Totally works out. It's been great for the patients.
So Pam, now that acute care is being handled by the larger hospitals, is it difficult for those patients that are chronically ill to commute so far?
You know what, Paula, we thought of that ahead of time. So we've created a shuttle service between the patients at our community hospital and at the larger hospital. This way patients can get to where they need, and also the important thing to focus is that most of the care will stay in the community. That's what we want. Most patients don't have to travel far to get good care. And if they do have chronic care, they can take a shuttle and get them to the larger hospital. And so keeping care in the community, that's what it's all about. That's why this whole merger began.
Pam gave us some great insights from the community hospital perspective. Now let's hear from a local resident. So, Mrs. Jones, everyone has heard the big news about how larger hospitals are joining with smaller hospitals. How has this changed your hospital experience?
Well, sorry I'm late, Paula, but I just came from my son's game. Go team! So Jimmy, he plays a sports game, and these young boys, they get hurt all the time. And so I'm constantly visiting the hospital for Jimmy, and I'm always there. But when I heard the news that he can get seen at the local hospital, I was thrilled, because then we won't have to make the extra trip to go farther, because we just moved here from California, and we don't have a car yet. So traveling to and from is a little bit hard, so I was actually happy that I can let Jimmy go have his checkups at the community hospital and not have to go any further than that. Yeah.
So is the care any different at the community hospital as opposed to the larger hospital?
Actually, I was concerned because I would love Jimmy to have the best care possible. I just love Jimmy. So, I was there, and I went to the community hospital, and the nursing staff, they were great. They remembered Jimmy's name. They gave him a little popsicle, and Jimmy was actually smiling. Normally we run out of there kicking and screaming, but this time he loved it. I just love them. I'm happy about this change.
Are there any disadvantages that you're facing regarding the merging of the two hospitals?
Yeah, for my appointments, I have a chronic illness. Don't tell Jimmy, he doesn't know. But yes, I keep having to go all the way to the big hospital for my appointments, and I would love it if I could be seen closer, or if the hospital had some kind of shuttle service. I would love that. I would suggest that to the staff. But I did express some of my concerns, and the staff said that they're suggesting an option. They called it something. What was it? It was like telemedicine. Yeah, telemedicine. Yeah, that's what they called it. And they said that we'd be able to use our phones or something to check with our doctors, and that would be great if I had that option. So I'm hoping maybe in the future they might have that, or have some kind of shuttle service to go to and fro. But that's pretty much the inconvenience that I have.
We are lucky to have Deborah Galifianakis, the host of Buy One Fern, to discuss the Affordable Care Act. Welcome to the ACP on ACA. So we've heard some things from Chuck and Pam about the ACA, but what exactly has been the impact of the ACA on hospitals? Is there anything good about it? I personally believe that the mission and intended goals of the ACA are good. As was mentioned earlier, the Act promotes more of a value-based system, and therefore greater quality of care through things like incentives, coverage for preventative healthcare costs, and increased funding for medically underserved areas. It is also promotes policies that hold hospitals and physicians more accountable for their costs and billing. Overall, the expansion of insurance coverage is intended to bring more patients care and consequently more revenue for hospitals. Although the goals of the ACA are to help larger hospitals, community hospitals, and patients, the implementation of some of its policies have caused more struggles than benefits for all three groups. I propose 3 recommendations or areas of improvement for the ACA. Number 1 is ACA policymakers continuing to take action on recommendations proposed by healthcare organizations such as the American Medical Association and Association of American Medical Colleges to ensure that ACA policies accurately reflect the needs of physicians and hospitals. An example of a policy that could be revised to better suit the needs of hospitals is the readmissions reduction program, which has received a lot of criticism for placing unreasonably high demands on hospitals. One of the greatest complaints that I've heard is that readmissions are not always avoidable and are affected by several factors such as poverty and lack of access to services that help with the recovery process. The second area of improvement for the ACA is once again requiring states to expand Medicaid coverage as the Act originally stipulated. States having the option to expand or not expand Medicaid coverage has caused financial problems for both community hospitals and patients. For example, rural hospitals in states that did not expand Medicaid coverage were twice as likely to be closed down as hospitals in states that did expand Medicaid coverage. And it has also been estimated that if every state expanded Medicaid coverage, the total number of uninsured adults that would be covered by Medicaid would come up to 5.2 million. Many more people who need coverage would be helped if every state expanded while also alleviating financial stress for community hospitals. The third area of improvement on the ACA would be delaying the disproportionate share hospital payment cuts even further or revising this policy. Although payment cuts were delayed to not take effect until 2018, community hospitals in particular are still facing major financial difficulties as they see the majority of underprivileged patients who may not all be covered by insurance if they're in a state that has not expanded Medicaid coverage. It was anticipated that the expansion of health insurance would cause hospitals to make more revenue, but it appears that community hospitals are still seeing many uninsured patients and are struggling to make enough revenue to offset the approaching cuts. This is Deborah Galifianakis with the ACP on ACA. Buy One Fern. Thank you for joining us on this segment on Care Moves to the Communities. Signing off, this is Paula.
Sorry I'm late, guys. The line at Starbucks is pretty long. So, are you guys sold?